Hi, welcome to tonight's VCU Health virtual seminar on aging athletes and keeping your joints healthy. My name is Samantha Kramer, and I'm a member of the marketing team at VCU Health. Today, we are joined by Dr. Seth Cheatham, an expert in orthopedics and sports medicine, as he discusses how aging athletes can protect their joints. Before we begin this presentation, I would like to first make note that we will hold all questions until the end. Please feel free to drop any questions you may have in the Facebook comments section throughout the event. We will address them during the Q&A. Dr. Cheatham is an orthopedic surgeon at VCU Health and associate professor in the VCU School of Medicine's Department of Orthopedic Surgery. Dr. Cheatham completed his residency at VCU Health in 2008 before finishing his education with a sports medicine fellowship at the University of Kentucky. Dr. Cheatham is the medical director for VCU Sports Medicine and the head team physician for VCU and Virginia State University. He and his team provide care for athletes across the region, including the following schools and organizations: VCU, Virginia Union, Virginia State, William & Mary, Longwood, Randolph-Macon, Richard Bland, Chesterfield County High Schools, the Richmond Flying Squirrels, and the Richmond Strikers. Thank you, Dr. Cheatham, for joining us today. I will now turn the show over to you.
Thank you, Samantha. It's my pleasure to be here tonight to discuss problems that we encounter with the aging athlete. This is something that we see very commonly in my practice, not only in my specific practice, but amongst our team. The goal tonight is to try to highlight some of the problems that are commonly encountered and some recommendations on how to stay active and healthy as we kind of move through life. Next slide, please. We can go to the next slide. So just a little bit more about the VCU Sports Medicine Clinic. We are a multidisciplinary team. So there is myself, and I have two other colleagues, Dr. O'Connell and Dr. Bapp, who are also orthopedic surgeons. We also have several non-operative sports medicine specialists as well. Dr. Caldwell and Dr. Deck are in our physical medicine and rehab department. And then we have Dr. Michael Pitzer as well, who is a family medicine physician. So between the six of us, we help take care of the schools that Samantha mentioned in the opening, which certainly keeps us busy. And that's just part of our practice. I would say that the majority of time, people that I see in the clinic, like earlier today, are your weekend warrior and your average athlete who are just trying to be healthy. VCU Health over the past couple of years has been fortunate to partner with the Richmond Marathon as a sponsor. The Sports Backers training team are athletes that we see very commonly here in clinic. And again, it's our goal to not only get the Division I or professional athlete back out there, but also just to keep people active and healthy. And that is done through a multidisciplinary approach. We obviously see people here at the Sports Medicine Clinic, which is kind of adjacent to the Siegel Center here on the VCU campus. But we also have clinics at Stony Point, at Short Pump, and then also out in the Williamsburg area, since we recently entered a health partnership with William & Mary a few years ago. We try to use all of our resources to accomplish our goals, whether that is with radiology that is here in the clinic, easy access to advanced imaging. We have physical therapy in most of our locations. And again, we work as a multidisciplinary team to try to take care of all those things. So with that and a little bit about myself and our team, we'll kind of work through some of the issues that we see here in clinic and try to help you out. So the realities of exercising in an older age. There's an old adage that in sports that father time is undefeated. And unless you're Tom Brady, that is probably true. But with all kidding aside, Tom has kind of championed his TB12 method, which might be a joke from time to time, but obviously it's very effective. And a lot of the principles of what he's trying to accomplish is part of the reason why he's still able to participate at a very high level at the age of 45, which I think he's about that. He and I are about the same age. But whether you're Tom Brady or a 60 or 70-year-old that's trying to run their first marathon, the reality is that things change when we're not 20 or 30, and that's okay. So it's natural to slow down. That doesn't mean that you necessarily have to stop doing things, but you have to understand where your body is at this point in time. This means a couple things. One, that you're more prone to injury, and we're going to talk about ways to prevent that. And also, when you do have injuries, it's slower to recover. That could be something as simple as a hamstring injury or an ankle sprain. And the same injury that you had when you were a 20-year-old college athlete is different than when you're 40 or 60 or 70. And I think that coming to that realization is important to not only maintain a positive attitude, but also to be successful in things that you want to do. So I think that with that, it's probably worthwhile to talk about some of the science of these things. And hopefully I don't lose you in the minutia of this. And again, if there's any questions, feel free, like Samantha said, at the end of this to chat with us, and I'll try to explain myself. So one of the things that it's important to remember is that aging bodies don't use oxygen as efficiently as we did when we were younger. And you're like, well, what does that mean? So one of the things that we can test for and they talk about is what's called VO2 max. And that number indicates how much oxygen your body can use per unit of body weight. And so essentially that number declines by about 10% per decade once we're over the age of 30. The higher your VO2 max in general, the more fit someone is. So the good news is that although that decline is natural, the more active you are, you can cut that decline in half or more, or essentially slow the rate of decline. And a lot of the things that we're going to be talking about is not necessarily preventing us from aging. It is more understanding things that we can do to slow down that decline. So much of the decline of your VO2 max is directly related to the decline in your maximal heart rate. So for instance, like if you jump on an exercise machine, and they will want you to plug in your age, they want you to plug in your weight. And part of the reason they do that is because that formula allows them to figure out, well, what is my maximal heart rate to determine what kind of workout that I'm getting. So again, that declines with age, and that's unavoidable regardless of how old we are. So there's a formula that they use to determine your maximal heart rate, and that is 220 minus your age. So again, that's going to stay relatively constant. Another thing to think about too is that for most sports, you need strength and power as well. And so a lot of that, in terms of our explosive strength, you require what's called type 2 or fast twitch muscle fibers. And again, there's type 1, which is slow twitch, and there's type 2, which is fast twitch. So research shows that the raw numbers of fast twitch fibers are lost with age. And they're lost at a much higher rate than slow twitch fibers, which are more important for endurance sports. So interestingly, for explosive sports like football or basketball, when we're younger, we're more effective. So for instance, like look at the NFL and the running back. They talk about people that are over the age of 27 or 28 being kind of like over the hill in terms of being an effective running back in the NFL. However, when you're talking about an endurance sport, such as like running, actually we get better as we get older. So the kind of like the golden period for long distance running is typically somewhere in the neighborhood of like 35 to 39. And the reason that is because not only do a lot of those runners have experience with running, but also we still are maintaining those slow twitch fibers that are good for endurance sports. So for instance, our Richmond's very own Kira D'Amato, who is a good friend and a patient of ours, recently set the American record for the marathon in Houston a couple months ago. She was a college athlete at American University, was obviously very effective and accomplished, and then became a mom, and she became a realtor and decided to get back into running just to kind of get back into shape. Obviously, she is an elite level athlete, but at the age of 37, she set the American record for the marathon. So you can still be accomplished as you kind of move through life, but I think that it's important to understand the physiology of things. And again, like I mentioned earlier, it does take longer to recover, both from injury as well as with overtraining, which is a problem that we sometimes run into. So, the problem is that we are all oftentimes very competitive people. And so sometimes it's hard to have inner perspective to determine, it's time to slow down. I need to back off. I need to listen to my body. And a lot of that is conversations that I'll have with patients when they come to clinic. But the good news is that a lot of these processes, again, can be managed. But again, you need to understand the physiology of things as we age. So that, again, that's important and something that I kind of emphasize. So kind of along those same lines, but moving to something else, first and foremost, the aging athlete needs to remain active. Everyone, not just the athlete, needs to stay active just in order to stay healthy as you advance in your years. Because the greatest really threat to health is inactivity. Inactivity, leads to obesity. It leads to other medical problems. So it's not just, staying active. It's the prevention of other things that might cause problems. Inactivity leads to more atrophy of our muscles. So that's another thing. So as we age, our muscles will become weaker and atrophied. But by staying active, again, that lessens that decline. Estimates are that regular exercise can slow physiologic decline associated with age by up to 50%. So again, you're not eliminating that, but you're certainly slowing the decline, which is important. Go ahead and next slide. So how do we do this? How do we accomplish these things? So again, understanding where our body is very important. So stretching, and I emphasize this regardless of the age. Now, it probably becomes more important when we're older, but stretching is extremely important. This helps prevent injury. The environment in which we are active is not necessarily always ideal. And if your muscles are not adequately warmed up, you're going to be more prone to strains and strains. So stretching certainly is an important part of that. Warming up and cooling down. So we want to kind of get our heart rate up. We want to kind of get a little bit of a sweat on before we really engage in some sort of rigorous physical activity. And again, this is more important as we age, just because, again, we're more prone to injury as opposed to when we're 20. Sometimes you can show up cold and go out there and play and be fine. The use of medications, and I can't emphasize this enough because this is a battle that I have with patients all the time in clinic. There's a common misconception that if you are hurt or that you're sore, that if you take a medication such as an anti-inflammatory, ibuprofen, Aleve, Tylenol, that you're just masking the problem and not really treating anything. And I think that's totally false. If we are sore or we have a problem, use of medications is an extremely important part of that. It not only makes you feel better, which is important, it allows you to return to competition earlier. I kind of half joke with our athletes here at VCU that during the season, we should just put anti-inflammatories in the Gatorade because inevitably the majority of our athletes are on those as we progress through the season. The seasons are very long. Participating at the Division I level is extremely tough on the body. And so, again, use of an anti-inflammatory is important. Varying exercises or cross-training. Again, I think that is also very beneficial. What that does is that it allows other muscle groups to stay engaged, and therefore you decrease the risk of overuse of a specific muscle joint. For instance, like if you are a runner and that is what you want to do, you may want to consider not necessarily running every day of the week. Maybe you run 3 days a week, but then 2 days a week you do something else, such as cycling, swimming, yoga, interval training, weightlifting, to again work on various other things. Weightlifting specifically would address some of the atrophy problems that we have as we move through aging. We also want to listen to our body, and again, this becomes even more important as we get older. Your body is a unbelievable machine, and you have to be able to listen to it. So, for instance, like if you are training for a marathon and all of a sudden you have pain in your foot, which you didn't have before, and you're like, well, this marathon is very important to me, I'm just going to keep running, and it gets to the point where all of a sudden you're limping, like you need to listen to that. That's your body trying to tell you that something is not right, and that it may require further evaluation with me or potentially a member of our team. I mentioned this a little bit earlier, but inactivity is more dangerous than the risks of an active lifestyle. So yes, things can happen if you are active, but again, inactivity, like I mentioned earlier, is more detrimental to your health than trying to stay active. Other things to think about is that as we age, we probably need to pay closer attention to our diet, both in terms of the quality as well as the quantity of food. That makes sure that we're consuming the right type of nutrients, such as carbohydrates, proteins, electrolytes, both before, during, and after exercise. Supplements can be important, such as antioxidants. So one of the things that happens to our body as we age is that there are things called free radicals, which they think are part of the reason why we get old. So things like antioxidants can reduce that oxidative stress in the free radicals. We want to avoid excess sugar. Some people will talk about reducing or eliminating alcohol. That's not to say that you need to avoid every pleasure in your life. There's a famous quote by Woody Allen that says, "You can live to be 100 if you give up all things that make you want to live to be 100." So I'm not saying give up everything, but I think again being mindful of your diet, things like sleep is important. Because during our sleep, that is where we release human growth hormone, which is needed for recovery and adaptive training. If we are sleep deficient, which can certainly happen to a lot of us, it decreases our immune function, it decreases our mental activity. So again, this is just another component of things that we can do to stay active and healthy. Go ahead, next slide. So again, the best treatment is prevention. Like I mentioned before, staying active is better than being inactive. Being inactive leads to things like obesity, which is a huge problem. I always tell patients that I see for arthritis of their knees that if you think about it, 3 or 4 times our body weight will go through our knee just by walking, let's say 10,000 steps a day. So if you are active and you can cut your weight even a little bit, inevitably you will probably feel better because you're your joints are just seeing less stress. You also really want to focus on proper technique. Again, it becomes more important as we age, because if you do things improperly, not only is that teaching you bad habits and creating bad muscle memory, but sometimes it predisposes you to other problems. So, for instance, if you were older and you were trying to play baseball or having some sort of throwing sport, and you started having some elbow pain, you're like, well, I'm just going to change things up to make this feel better. It can then lead to other problems such as shoulder problems. So you always want to emphasize proper technique, in addition to the things that I discussed earlier as well. And again, just the importance of cardiovascular fitness. I think that it's, again, for all the things that we talked about earlier, it's just important to stay active. But again, a lot of the physiology that we talked about is really only one kind of piece of the puzzle. A lot of times when forced with a physiologic decline, we get frustrated, and an ultra competitive person might quit altogether, or you might just lose motivation to stay fit because you're not seeing the gains as quickly as you expect to. I think the reality is that there's not necessarily a one size fits all approach to staying motivated. So one of the easiest ways to stay motivated is to satisfy, or again, our competitive urge. And again, doing things like cross training can be very beneficial to do that. So again, if you are a runner and you decide to cross train, which, as I mentioned before, is important, to not overtrain and to avoid injury, you may find that you are a really good cyclist, or that you really enjoy yoga. And so again, things like that all of a sudden bring joy back to exercise again. If people will remember, Reggie Miller was a very famous basketball player. He obviously is retired. He actually took up mountain biking as a way to stay active because he just couldn't play basketball anymore. And it turns out that not only does he really enjoy mountain biking, but he's really good at it too. And he's gone on to do some racing, and has received some podium finishes with that. So again, trying something new is not only good from a physiologic standpoint, it can also be good from a psychological or mental standpoint as well. So again, the bottom line is that staying motivated requires some internal retrospection. So again, understanding where we are in life, and it might involve more than one single activity or hobby. But again, the most important thing is to keep moving, and to stay active. Next slide. So I think I have kind of hit the high points on that, and I think Samantha is back with us, and I think that we should hopefully have time now to answer some questions.
Yeah, absolutely. Thank you so much for that informative presentation, Dr. Cheatham. We will open the floor now to any questions. So before I address the ones that came in through the Facebook comment section, I would like to first read a few that we got in advance. So the first one is, how do I know when my pain is no longer just soreness from exercise and it's time to see a doctor?
That's a great question. Again, soreness is not uncommon as we are trading, and certainly can happen more as we are either picking up a new activity, or if we're trying to do things like, for instance, like run a marathon for the first time. I think the important thing is that if the soreness or the pain is persistent, or worsens, then it's never a bad idea to get checked out. I think sometimes people feel, I hear all the time, people come in, they're like, I was almost going to cancel this appointment. I felt it was stupid, but I just wanted to get checked out. There is nothing wrong with getting checked out. Like that I mean, as a orthopedic surgeon, that's the easiest appointment that we have, because it's people that are being active. There's nothing wrong with them, and reassuring somebody that they're fine is okay. It honestly is probably better to do that than to ignore things. And then you come in with a bigger problem that could have been prevented earlier. So I guess the long-winded answer to your question is, if the symptoms or the soreness worsen or persist, I definitely would get checked out. If they all of a sudden prevent you from doing the activity that you were doing, I would get checked out. Or again, if you just have, that feeling of like, I just want to make sure I'm okay, that is okay.
Mhm. Awesome. Second question here is, should I be prioritizing lower impact exercises like biking or swimming?
So I think that it depends on where you are in life and then other potential problems that you might have. So, for instance, as I mentioned earlier, I think that cross training is extremely important. And that's probably true regardless of age. This is part of the problem that we even have with our younger athletes. There's a whole other talk on that, is that, youth these days start in these specialized sports at the age of 9, and they play baseball 12 months a year. And that's not good for you either. So I think that, cross training and doing other sports is important. Now, lower impact activities, when would that be important? So if we have arthritic conditions, I think that is good. There's an old wives' tale that if you run, that you're just, hurting your knees and you're causing arthritis. That's not necessarily true. There's nothing inherently wrong with impact activities and running. And to be honest with you, if you're able to do that and your body responds fairly well to those activities, that's fine. However, if you have, let's say, advanced arthritis, or let's say you have had a hip or knee replacement and your surgeon doesn't want you doing something like running, I think those are where lower impact activities such as biking and swimming can become very advantageous. Just to, again, stay active and to prevent, or slow down, I should say, the process of aging.
Mm-hmm. Thank you for that answer. The next question is, I have consistent joint pain but want to stay active. Should I consider a joint replacement?
So there's a couple different parts of that. Number one is that what I tell people in clinic is that, number one, you will get X-rays or radiographs. The arthritis should be relatively severe. You should have failed conservative treatment, meaning that you've tried medications such as anti-inflammatories, that you've maybe tried injections, physical therapy, potentially using some sort of assistive aid, other over-the-counter medications. And then you have to be mentally and physically ready to have a joint replacement because it's a big surgery. It's very effective for severe arthritis. But, I always tell patients, I'm never going to sit here and tell you that you need one. It's the other way around. So if the arthritis is bad enough to where you can't do the things that you want to do, and you are okay with doing lower impact activities following that joint replacement, again, such as biking, swimming, elliptical, yoga, I mean, the list goes on, then I think you should. But it's not just, oh, I should get a knee replacement so I can stay active. The first and foremost reason to get it is because of significant pain that is limiting you not only from being active, but also interfering with your activities of daily living.
Right, that makes sense. Let's see. Our next question here is, will staying physically active help me prevent arthritis as I age?
Unfortunately not. Again, the arthritis, by and large, there's predominantly a genetic component to it as well, which we can't change. It's just the way that we are. I think that there are other things that will cause arthritis. So, for instance, like if you've had knee injuries before, for instance, like if you tore your ACL when you were in high school, or you've had meniscus surgery, and you've had a large part of your meniscus taken out, that will probably predispose you to getting arthritis earlier in life than you would have otherwise had. However, being physically active also helps us maintain a good body weight. And certainly that is important. So for instance, if we are overweight or obese, that can certainly accelerate the arthritis process. So again, staying physically active is important for all the reasons that we mentioned earlier, but it in of itself won't necessarily prevent arthritis.
Mm-hmm. And our last submitted question is, other than surgery, what are some options to address joint pain?
Sure. Again, I think that is you have to first of all understand, why am I having joint pain? It's not always arthritis, or shoulder pain is not always because you tore your rotator cuff. So that is one of the benefit of seeing me or one of my colleagues in clinic, is that we can do a good evaluation, whether that's just here in clinic or whether that's with an MRI, kind of determine to the true source of the pain. If, for instance, it's like a tendonitis, things like a cortisone injection, physical therapy, anti-inflammatories will be options. If it's arthritis, a lot of those things hold true. It's, again, medications such as anti-inflammatories, weight loss, activity modification, injections. Within injections, there are any number of different things that you can do, ranging from the cortisone injections, which are probably the most common thing, to other types of injections that are out there as well, whether that's viscosupplementation injections, which I kind of explain to patients is kind of like an oil change for your knee. There's some anti-inflammatory properties to it. There's some lubricating properties to it. And then there's other newer injections out there, such as PRP and stem cells, which are currently being injected, that have some promising initial research behind them.
Okay. And we did get a couple of questions through Facebook. So our first one is, are there any suggestions for physical labor employees like delivery drivers to help keep joints healthy?
Yeah, I mean, I think that obviously the type of job that you have can play a big role in things, right? So if you are an employee in physical labor, like a delivery driver, or you work construction, or you're just on your feet for an extended amount of time, that's a totally different load on your body, as opposed to if you have like a sedentary type job, like you work in an office or something like that. So for manual laborers or heavy demand laborers, again, I think that things like trying to get adequate sleep, making sure that you focus on your appropriate diet as you age, trying to stay as physically active as you can is important. And again, it doesn't necessarily mean running. Like you might, for instance, like you might have been a runner when you were 20 or 30, and then because you were older, or maybe you gain weight, or things have changed, now when you run, it's not as enjoyable, or it hurts. I think it's therefore important to evaluate other things that you could potentially do to stay active. Again, you might find a new hobby or activity that you're really, really good at, and that you enjoy, and that still makes you active. And so, I think that it's important to keep an open mind as we age. Again, listen to our bodies, and again, try to maintain as much of an ideal body weight as we can. Eat healthy, sleep well, all the kind of normal things.
Mm-hmm. And our last question here is, do you have any tips for safely riding a bike as one ages? And are those tips the same for using an indoor exercise bike?
So I think that in terms of biking, one of the things that we focus on a lot is the seat height, and that is something that if you, for instance, if you buy your bike at a bike shop, or even a physical therapist can evaluate, because depending on what you have wrong with you, you may want to adjust the seat of your bike. So, for instance, like if you have bad pain from wear and tear of the cartilage underneath your kneecap, you want to avoid activities that put a lot of stress on that part of the joint, which would be deeper knee flexion, right? So like squats and lunges and that sort of thing. So if you are riding a bike, you might elevate the bike of your seat so that when you pedal, your knee doesn't go into this deeper knee flexion as you would have otherwise. And I also think that in terms of like outdoor versus indoor bike, that might not necessarily hold true. But for instance, like indoor bikes, there might be a difference between a regular bike, like a Peloton, and like a recumbent bike. So for instance, not that I have major back issues, but I don't like riding on a upright bike like a Peloton. Like I just don't feel comfortable. My back kind of hurts. So I have a recumbent bike at home. I still feel like I get the same physiologic workout from that. But again, from an indoor bike, if you had, for instance, like back issues or other problems, again, something like a recumbent bike might be better than a standard bike. And again, potentially adjusting the seat height can be important as well.
Okay, that is a great tip to keep in mind. And that does conclude our questions. So Dr. Cheatham, thank you so much. It was a pleasure having you join us this afternoon for this discussion. And for more information about orthopedics, follow VCU Health on Facebook, and you can visit vcuhealth.org. So once again, thank you, Dr. Cheatham, and to all who joined us today, and have a great evening.
Thank you.